Welcome back, everybody. Today, we're going to do a deep dive on the story of penicillin.
Okay.
And, you might think it's just like a simple tale of mold in a petri dish, but
Yeah.
it's way more interesting than that.
Yeah.
We're going to be looking at a YouTube video called Penicillin: From Fleming to the Pharmacy by Patrick Kelly.
Okay.
Have you heard much about penicillin beyond like the basic story?
Um, I mean, most people kind of know the simplified version of the story with Fleming,
Right.
but there's a lot more to it than that.
Okay, so like, Fleming petri dish and boom, penicillin. Is that kind of it?
I mean, the way it's often told, it's like he was the first one to ever see mold killing bacteria.
Right.
But, ancient civilizations, even the Egyptians were using molds to treat infections.
Yeah.
And even in the 1800s, scientists like John Tyndall and Joseph Lister were writing about penicillium's antibacterial properties.
Huh. So he wasn't really like a lone genius then.
Well, and there's even some debate about whether his famous observation went down exactly as he described.
Oh, really?
Some scientists think that the way he described finding the bacteria-free ring wouldn't have been possible unless the mold was already in the dish before the bacteria.
Oh, so it was kind of like a scientific myth?
Yeah, maybe a bit of storytelling going on.
Yeah, so what did he actually contribute then?
Well, he did show that penicillin could stop certain types of bacteria from growing what we call gram-positive bacteria.
Right.
But it wasn't so effective against other types, the gram-negative bacteria.
Okay, so what's the difference? Why would that be?
It's all about their structure, specifically their cell walls.
Okay.
You can think of penicillin like a tiny demolition crew that targets a specific building material in these walls.
Okay.
And gram-positive bacteria have a lot of this material, making them easier to break down.
Mm-hmm.
Gram-negative bacteria have an extra layer of protection, like a different kind of building material.
I see.
And that makes them a lot tougher for penicillin to penetrate.
So it's like they were wearing armor or something.
Yeah, exactly.
Like they're just...
But even though Fleming identified this, powerful tool,
Yeah.
he couldn't quite figure out how to purify it effectively.
Okay.
And without that, it couldn't really be used as a medicine. So
Right.
his research kind of stalled for a bit.
So who picked it up after that?
Well, more than a decade later, a team at Oxford University, led by Howard Florey,
Okay.
they started to unlock penicillin's true potential. They had a different approach.
Yeah.
They really focused on working together across different scientific disciplines.
Okay.
Their team included Ernst Chain, who was a chemist, and Norman Heatley, who was a biochemist.
Right.
And they really recognized the potential of penicillin as a medicine. And they were determined to find a way to produce it and purify it.
So what kind of challenges did they run into?
Imagine trying to extract a tiny amount of a substance from a common mold.
Right.
It was a huge challenge.
Yeah.
To grow enough of it and then purify it to a level that would be safe and effective for testing.
Yeah, for sure.
Early on, Heatley had actually developed a way to grow the mold in these shallow dishes to try to maximize the surface area. But they knew they needed a more efficient method to produce larger quantities.
Right.
And that's where deep tank fermentation came in.
Okay. Yeah, they mentioned that in the video.
Yeah, it allowed them to grow the mold in these large controlled tanks, kind of like brewing beer on a massive scale.
Wow.
But one of the most interesting parts is how serendipity played a role.
Oh, really?
They were working with different strains of the mold.
Right.
But a lab assistant named Mary Hunt found a cantaloupe covered in a particular type of penicillin at a local farmer's market.
You're kidding.
And it turned out to be incredibly productive.
What are the chances?
I know, it's amazing.
So did they just switch over to that one then?
They took that strain and exposed it to radiation, and that created a super strain of penicillin.
Oh, wow.
And this ended up being the source of most of the penicillin produced worldwide.
That's incredible.
Yeah.
So while all this was happening in the U.S., what were the scientists back in Oxford doing?
They were tackling a different challenge,
Oh,
trying to figure out the exact chemical structure of penicillin.
okay.
This was crucial because it would allow them to move away from relying solely on the mold and towards producing a standardized version in the lab.
Yeah, makes sense.
And to do this, they used a powerful tool called X-ray crystallography.
So how do X-rays help you understand the structure of a molecule?
Well, it's a bit complicated, but basically scientists can analyze how X-rays bounce off a crystallized sample of penicillin.
Uh-huh.
And this creates a pattern that reveals how all the atoms are arranged within the molecule.
Oh, so it's like creating a 3D blueprint or something.
Exactly.
Wow.
And leading this effort was a brilliant scientist named Dorothy Crowfoot Hodgkin.
Okay.
She was a pioneer in the field, and her work on penicillin was a major breakthrough.
So by the fall of 1942, they had figured out how to mass produce penicillin and they had cracked the chemical code.
Yeah.
What happened next?
Well, that's where things get even more interesting.
Okay.
World War II was raging, and the need for effective treatments for battlefield infections was growing every day.
Yeah.
And that's when the story of penicillin takes a turn towards the world of industry and politics.
Oh, okay.
Yeah.
All right, so before we move on to that, though, what's one thing you think people should take away from this first part?
I think it's just important to remember that scientific progress isn't always a straight line. You know,
Right.
it's often messy and collaborative with all these unexpected twists and turns.
Yeah.
And sometimes a little bit of luck goes a long way.
Like a cantaloupe.
Exactly.
Yes.
Yeah.
All right, well, we'll pick up the story in part 2, so stay tuned. Okay, so we left off with them figuring out how to make penicillin in large quantities and
Right.
knowing the chemical structure, but World War II is in full swing now, so
Yeah.
I'm guessing the demand just went through the roof.
Oh, absolutely. Battlefield injuries and infections were taking a terrible toll,
Right.
and the Allied forces were desperate for effective treatments.
Yeah.
So this is where the U.S. government really stepped in.
Okay.
They realized penicillin could be a game changer in the war.
So how'd they go from like a lab experiment to something they could use widely? I mean, it wasn't just tell the companies to start making it right.
No, not really.
Yeah.
At that time, penicillin production was still in its infancy.
Right.
There were a lot of technical challenges.
Yeah.
And companies weren't exactly eager to invest in something that wasn't proven to work on a large scale.
So what convinced them?
Well, the government had funding and influence.
Right.
The Office of Scientific Research and Development,
Right.
the OSRD,
Uh
they basically said, look, we need your help.
huh.
We need you to figure out how to make penicillin on a massive scale,
Right.
and we're willing to fund it.
So they gave them like a financial incentive and also like a patriotic.
Exactly.
Okay.
And that's how the Penicillin Producers Industry Advisory Committee was formed.
Okay.
This committee brought together the government and companies like Merck, Pfizer, and Squibb. Their mission was to coordinate research, share knowledge, and overcome the hurdles to mass production.
Wow. So pretty unprecedented partnership.
Absolutely.
So then Pearl Harbor happens. Does that change things?
Dramatically.
Yeah.
The attack on Pearl Harbor propelled the U.S. into the war
Right.
and created a sense of urgency.
Mm-hmm.
Suddenly, the need for penicillin became absolutely critical.
Right.
The OSRD poured resources into the project.
Okay.
They needed to get this drug to the soldiers.
ASAP.
So what about all the secrecy around penicillin? Why was that?
It was a delicate balancing act.
Yeah.
They wanted to encourage research and production,
Right.
but they also didn't want to create false hope.
Yeah.
Imagine if the public knew about this wonder drug,
Right.
but it wasn't available yet.
Yeah.
It could have been chaos.
So they had to kind of manage expectations while they got everything scaled up.
Exactly.
But did they manage to keep it completely secret?
Not entirely, word did get out.
Oh, really?
And there's a fascinating story about a woman named Ann Miller in 1942.
Okay.
She was hospitalized with a severe infection,
Uh-huh.
and nothing was working.
Yeah.
Her condition was getting worse rapidly.
Oh, wow.
One of Miller's fellow patients was friends with Howard Florey,
Oh, wow.
the scientist leading the penicillin research at Oxford.
Okay.
So her doctor contacted Florey, and he pulled some strings to get a vial of penicillin sent over from Merck.
So even at this point, it was being seen as like a last resort,
Ooh.
like when all else fails.
But here's the thing, that vial sent to Miller contained a big chunk of the entire U.S. penicillin supply.
Wow.
They had to get special permission.
Seriously?
Yeah, and the vial was even given a police escort
You're kidding.
to make sure it reached her safely.
So it was really precious at that point.
It was.
So what happened to her?
Within days of receiving her first dose, her fever broke and she started to recover.
Wow.
She became the first person in the U.S. whose life was saved by penicillin.
That's amazing.
It was a turning point for her and for penicillin.
So that's like a real testament to its effectiveness.
Definitely.
But it wasn't just like individual cases, like that was it. They mentioned something about the Coconut Grove fire.
Oh, yeah, that was in 1942, a devastating fire at a nightclub in Boston.
Right.
Hundreds of casualties, many with severe burns.
Yeah, that was awful.
Merck, one of the companies involved in penicillin production,
Uh-huh.
they provided large quantities of what was essentially penicillin broth.
Like the liquid the mold was grown in?
Exactly.
Okay.
And even in that raw form, it seemed to help.
Wow.
The media coverage of the fire and the use of penicillin to treat the victims really fueled public fascination with this drug.
Right.
Yeah.
And that must have made the demand even crazier, especially with the war going on.
Oh, absolutely. And that created a big problem.
What do you mean?
They were making more as fast as they could,
Right.
but they still didn't have enough.
Yeah.
So they had to decide who got priority.
So who ended up getting it?
The War Production Board, they were created to oversee wartime production.
Right.
They decided to prioritize penicillin for military use.
Okay, so the soldiers, basically.
Yeah, soldiers on the front lines were the most urgent cases.
That makes sense, I guess. But it must have been hard for the people who couldn't get it.
It was a really difficult situation.
Yeah.
But it was wartime.
Right.
The government had to make tough choices.
Yeah, for sure.
And while it makes sense to prioritize the soldiers, it also brings up some ethical questions about who gets access to life-saving treatments.
Right, yeah, there's two sides to it.
Exactly.
So even the best scientific discoveries can have these unintended consequences.
Absolutely. And we'll talk more about some of those implications in the next part,
Okay.
including antibiotic resistance.
Right.
But I think it's important to mention how penicillin production really changed the pharmaceutical industry.
It wasn't just a scientific breakthrough, it was an industrial one too.
Exactly. The government's involvement in penicillin production created this new model for collaboration between the public and private sectors.
Right.
And as they made more penicillin, the costs dropped dramatically.
Oh, so that made it more accessible.
It did.
So a win-win.
Well, not completely.
What do you mean?
Penicillin itself wasn't a huge moneymaker for pharmaceutical companies,
Okay.
but the process of developing and producing it changed the industry.
How so?
They learned how to mass produce drugs,
Okay.
how to work with the government, and how to manage public expectations during a crisis.
Interesting. So it really shaped the whole industry.
It did.
So penicillin's legacy goes way beyond just treating infections.
Absolutely, and that's a story that we could explore further another time.
Okay, so we've talked about the discovery of penicillin, the mass production, the war effort.
Right.
But as you mentioned, there's this issue of antibiotic resistance.
Yeah, it's one of the biggest challenges facing medicine today.
Yeah.
And it's really tied to how widely we use antibiotics, including penicillin.
Okay.
Bacteria are incredibly adaptable.
Right.
So when exposed to an antibiotic, some will survive.
Because they're like the toughest ones.
Exactly. And they pass those survival skills down to their offspring.
So it's like we're making them stronger.
It's a process of natural selection.
Right.
The more we use antibiotics, the more we're creating an environment where the resistant bacteria thrive.
Yeah, it's like we're training them without meaning to.
Yeah, in a way.
I think the video mentioned that penicillin resistance showed up pretty quickly after it was introduced.
Yeah.
Like, wasn't it just a few years after they started using it widely that they saw resistant strains of Staphylococcus aureus?
That's right. By the late 1960s, over 80% of Staphylococcus aureus infections were resistant to penicillin.
Wow. So what did they do then? Did they have to like start over and find something to replace penicillin?
Well, the success of penicillin had triggered a lot of research into other antibiotics.
Okay.
So scientists were already developing new drugs like methicillin,
Right.
which seemed really effective at first.
Against the resistant strains?
Yeah, but bacteria are always evolving.
Right. So it's like an arms race.
Exactly.
And that's how we got those superbugs like MRSA.
Right, methicillin-resistant Staphylococcus aureus.
Yeah.
It's a perfect example of antibiotic resistance getting out of control.
It's resistant to so many antibiotics.
Yeah, that's what makes it so difficult to treat.
So it's like even our best efforts can have these downsides.
It really shows the complexity of scientific discovery.
Yeah.
There's always this balance between innovation and then the unintended consequences.
Right, and then we have to adapt.
Exactly.
So what can we do about antibiotic resistance? I mean, is it a losing battle?
I don't think so.
Okay.
But we need to approach it from different angles.
Okay.
Of course, we need to keep researching new antibiotics.
Right.
But we also have to be much more careful about how we're using the ones we already have.
So like doctors being more careful about prescribing them
Right, and patients understanding that antibiotics aren't a quick fix for everything.
and that you have to take the whole course.
Exactly.
I've also heard about educating people about the dangers of overusing them,
Yeah, that's a big part of it.
like making people aware.
We have to realize that antibiotics are a valuable resource.
Yeah, not just something you take whenever you have a sniffle.
Exactly.
Well, it's amazing to think that something as simple as mold could have such a huge impact on the world.
Yeah, from that accidental discovery to everything that came after.
Both good and bad.
It's a great example of how science is a process.
Yeah, not just an endpoint.
We're always learning, adapting, and trying to solve new problems.
Well, I've learned a lot today. Thanks for breaking it all down.
It's been great talking about it.
And to our listener, if you found this interesting, be sure to look into it more yourself.
Yeah, there's so much information out there.
All right, well, that's it for our deep dive into penicillin.
Until next time.
Keep on learning, everybody.